In this video, we'll discuss about headache. So first of all, coming on to the definition. So it is basically a term which is used for all the aches and pain that are localized in the region of head. Now coming on to the mechanism. Now basically it will occur because if the following structures that I'll mention below, if their stretching happens, so that will produce the headache, the pain of headache. So the to remember the structures, just remember the acronym as TEDS. All right, so T stands for tissues of eyes, ear, nasal sinuses. I stands for intracranial, dural, venous sinuses. D stands for dura mater at base of skull or base of brain, sorry. Now S stands for skin, subcutaneous tissue, muscles, arteries, skull and periosteum. So stretching of all them will lead to headache. All right, so now coming on to basically how it occurs. All right, so the pathophysiology. Now this is a very important and confusing thing to remember, but I'll make it easier for you. So first of all, we will talk about the arteries. In arteries, what happens is dilatation, distortion and distension. Okay, the arteries are dilating. Now coming on to the veins. Now in veins, what you will see is you will see traction and displacement. All right, then in nerves, what can nerves actually undergo? Compression, traction and inflammation. All right, then talking about the muscles. Now muscles can undergo the spasm. So basically first write the muscles, cranial muscles. Now these cranial muscles can undergo involuntary spasms, inflammation, trauma. Also, it can occur if there is some meningeal irritation or raised intracranial tension. Okay, now a very important thing to remember is the causes. All right, for the causes, what I want you to know is there is a IHS criteria for headache. Okay, now what this criteria does, it divides the headache into primary and secondary. So we'll discuss it over here. So the primary and the secondary. Now, in primary, what is the reason is that the cause is not identifiable. So the cause is not identifiable. All right, it is basically occurring due to the it is basically occurring due to the unknown cause of the idiopathic causes. So to remember it, first of all, just remember that there is MCM tension. Just remember this thing, MCM tension. So M stands for migraine, C stands for cluster headache and chronic hemicrania. Now another M stands for miscellaneous headache not associated with structural lesion. By tension, remember tension type headache. Okay, it's easy to remember. Now for secondary is basically where you know the cause, so it is very understandable. All right, so first of all is because of some trauma, so we will make it traumatic headache. Then headache due to vascular disturbance. Then the third one will be headache due to non-vascular intracranial disease. Then headache associated with substance abuse or their withdrawal. Okay, then remember that headache, it can also occur due to systemic infection. Headache due to systemic infection. Then it can also occur due to the metabolic disease. Then headache can occur as a result of referred pain. Then cranial neuralgia. Also unclassified headache. Alright, so 6, 7, 8, and 9. Okay, now coming on to this is the completion of headache. Next, we'll discuss about migraine.